I think what's happening in the world right now, or in a lot of countries, is the wrong type of nationalism because a lot of people in different countries or nationalities wanted to get the vaccine first. Well, it is not a competition, and the only competition that we have is against the virus.
My name is Lloyd Nunag, and I'm a Filipino research nurse.
As a research nurse specifically, I've been exposed to a lot of clinical trials, and of course, I know that there are some potentially good vaccines that we can have in the UK and hopefully worldwide, but without strict protocols and policies from the government to protect the vaccine and the fair pricing, it's gonna be more difficult for developing countries to afford the price of that vaccine that we're gonna have. And if it's not gonna work, if only the rich people or the global north can only have the vaccine. I'm planning to go home to the Philippines because it's been 2 years since I came back home. But with the current situation, one of my brother, he already lost his job and his partner because of the economy in the Philippines because of the virus. My siblings, they're still in high school, and we don't have a reliable internet connection back home because we live in a rural area in the Philippines, and we don't have the resources like laptops for the three of them to study at the same time. So I really feel for people from the global south, especially young people who would need to adjust and live in this new normal in the year ahead. And seeing people right now outside not wearing masks, being in close proximity to each other. I think for people not working in the hospital or hasn't been in the hospital during the pandemic, it's quite easy for them to be relaxed because they don't really know what's happening. So I really like the idea of exposing what's really happening inside the hospital just so people will be more aware and hopefully cared because it is really scary.